Welcome, Jess Shursky. Thank you so much for being here.
Thank you for having me.
I wanted to introduce you to my people because I think that there's a lot of people that could use information and help from someone like you, and they maybe don't even know that it's available. So, will you tell us who you are and what you do and where you are and who you help?
Oh, okay. So my name is Jessica Shursky. I'm a physical therapist and I specialize in pelvic floor PT in Bedford, New Hampshire. So my clinic is Wellbridge Physical Therapy. And yeah, I specialize I mostly see women. So yeah.
And what are the women coming to see you for, specifically women like 40 plus? What are they coming to see you for?
So I see a lot of everything. I see a lot of very complex cases, but I think most common I see incontinence, and that could be urge or stress incontinence. I get a lot of pelvic pain and dyspareunia, which is pain with intercourse.
Okay. All right. We're going to talk about libido and sex later. So everybody needs to keep listening because they're going to hear a lot more about that. Why are you passionate about working with this population? Like, what is your why?
I think it's like helping people solve a problem. Specifically for my patients, they're usually coming to me with, they've seen other providers and maybe haven't gotten any answers, or they've been told that that's normal, or this is a part of aging. So there's all these reasons that they're given why they should just deal with it. And so when patients finally come to me, they're like, I my quality of life is poor. Like, I need help with this. How can you help me? So I think that's the best part, is like, yes, this is not normal. Yes, like, I'm glad you're here, you know, and like, this is how I'm going to help you. So that's really what drives me. It's like, being in private practice, I'm able to really like focus on the quality of care. And so, I'm able to kind of help solve this, like, how can I help you? Let's get to the bottom of this. Let's address these issues, and no, it's not normal, or yes, I can help you. So that's, I feel like, really helpful for patients when they've been bounced around, especially in this healthcare system, getting to a provider that can finally, like, they can tell these things to, and I, can help them.
And I feel like that this is normal thing has come up a lot for a lot of people in a lot of different fields, right? So, like, for example, what I do, like, is it totally normal to have frown lines on your face?
Mhm.
That is normal. I mean, in as
Mhm.
much as it happens to almost everyone eventually, if that's how you want to define the word normal. But is it normal, meaning that the nonverbal communication is that you're angry all the time when you're really not? Like, no, that's not like no, like some of us feel like normal was when we were 20, like that was normal, and anything that has changed doesn't feel normal anymore.
Right.
And it
Right.
comes up in the menopause conversation too, like, oh, well, this is a normal transition.
Mhm.
So you shouldn't worry about the night sweats. Like that's just what's going to happen.
Right. And I think that, a lot of times as a woman, like, your concerns are often dismissed, unfortunately. Like, oh, yeah, you have pain, but pain is normal, right? But pain is subjective. So your normal, like, might be normal for you, but isn't normal in general, right? Like, I've had pain with intercourse, for 20 years. No, that's not normal. But how do you know that unless you're talking about it, unless you talk to your provider about it? Like, you don't know until you know. So,
And not only that, but why is something being normal a reason to not do anything about it?
yes.
Like,
Yeah. Yep.
like this is normal, but it's totally ruining your intimacy with your spouse, but it's normal, so we're not going to do anything about it. That makes no sense at all.
Right. Right. Exactly. And it's just, yeah, it's that's the thing with the women that are, my age group, perimenopause, menopause. They're coming to me, they're like, I don't want to live like this anymore. Like, I'm tired of this. Like, I don't want to have intercourse because it hurts. I don't want to, like, pee myself. I don't want to be looking for a bathroom everywhere. They're just tired. They're like, okay, maybe my kids aren't little anymore. I can finally, like, focus on myself. I'm ready to, like, improve my health. And it's like, it takes, time to get to that point where you're like, I'm ready, and that's a great place to be, because you're like, I'm finally going to get answers. I'm going to take care of myself, and I'm going to do what I need to do.
And then so many people, if they don't find the right provider, their PCP is like, oh no, you're fine. I had a patient, and part of my normal consultations is asking about where people are in the menopause transition because it does affect your facial aging as well. And I said, do you know where you are in the menopause transition? And she said, oh yeah. I'm kind of in the middle of it. And I said, how's it going? How are you doing? Well, I talked to my doctor and they said everything's fine. She's like, I mean, I never want to have sex with my husband ever again, but they said that was fine, so I guess I'm fine.
Mhm.
And I was like, you need a second opinion. Like, I just can't imagine what it's going to do to your marriage for the next,
Yeah,
whatever, how many years do you have?
right,
20, 30 years?
right, right. And that's yes. And the patients that come to me, they're like, they've dealt with it for so, or they just push through it. They're like, yeah, it hurts, but it's my obligation or duty. And I'm like, ah. And you get into this like pain cycle, and it usually gets worse. And so it's like if I can get patients where we can kind of intervene before it gets to this point where like they're running away, they don't want to ever. So it can be helpful to find providers that actually yes know what's going on and can help you, right, and don't dismiss you. And unfortunately that is kind of the system we're in right now, where you get dismissed. And so when patients come to me, it's like, yes, I've seen this before. Yes, this is what, here are some suggestions, here are some providers that will listen, here's. So I think that that's very, very helpful, to patients looking for answers. Yeah, somebody that will
Absolutely.
actually listen.
So we talked about kind of painful intercourse. What are some other common conditions that you see in women in kind of the peri to postmenopause age range?
Yeah. Well, pain with intercourse, typically when I see them, it's often caused by changes in the vagina with menopause, with the hormonal changes. So a lot of times it's dryness or vaginal atrophy. So they're just not, things are not the same, right? They are not getting lubricated. So it's causing pain, and pain is kind of a cycle. So, you have dryness, it's uncomfortable, you don't want to do it, and then your brain is going to protect you from that pain. So like whenever you anticipate, and if you're associating it with intercourse, whenever you anticipate that there is going to be intercourse, your body's like, oh, like it's going to hurt, it's going to hurt, it's going to hurt, and then we get into this like tension, 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 which just keeps getting worse over time. So if you're not addressing it, if you're not getting help, if you're not doing anything about it, like either a hormone replacement, or even like topical estrogen, then those things will just get worse over time. So recognizing that and being able to help with that is important. And muscle spasms, once you have muscle spasms in the pelvic floor, it's really about addressing that as well. So like just like you would get muscle spasms or trigger points in your like neck muscles, that can happen in your pelvic floor. Unfortunately, they're muscles just like any other part of your body. So when you get a trigger point in your pelvic floor, it's super uncomfortable. So ways to kind of like work that out and improve that tissue health so that you don't fall into the cycle of like it's this pain is just going to keep getting worse, and I never want to do it.
Yeah. And I can tell you I've experienced that for the first time. I was 40 the first time and I had a pelvic floor spasm, and what it felt like was birthing a child. That's exactly the sensation that it was like crowning a child. It was excruciatingly painful. I thought I was going to explode and I had no idea what the problem was. So this leads us to a different kind of issue that a lot of women have in their pelvic floor, which is too much tension. You're alluding to that, but it applies to one of the what I would consider, but you should correct me if I'm wrong, big myths that a lot of people believe about pelvic floor health, which is that everybody should be doing Kegels.
Hmm. Hmm.
Tell me about that, because it's not the case.
I know, I love it that you said that. I really appreciate that. Yes. And I think, part of it is I think more people are talking about it, and there's a lot of information online. So like how to do a Kegel, what is a Kegel, what's my pelvic floor, this is how we're going to do a Kegel, do this many a day, do this. And so I think people automatically go to this like, okay, Kegels are going to fix everything, right? But then you get the patients that are like, okay, I'm doing Kegels and it's actually getting worse. So why? Why isn't this fixing my problem? And the answer is that the pelvic floor is very complex, and if there needs to be good muscle balance. So if you don't have muscle balance, if you have too much tension in your muscles, you're going to have poor control. So I think that that's the hardest thing for people to wrap their brains around is that, like, wait, I'm strengthening my muscle, it should be strong. Well, tight muscles are weak muscles. So if the muscles are too tight, it can cause dysfunction as well. And you can have leakage if the muscles are too tight. And I'll tell you, I've been doing this for 16 years. I still am like surprised by what I find. You know, I have a patient and I'm going through like their subjective and like, you know, what are you experiencing? What's this? What's that? And I do an internal exam and holy moly, like this is not what I was expecting. Oh my gosh, you have lots of tension. Please don't do any more Kegels. This is not going to help your problem. And you know, I think it's great that you said that because I think it's important for patients to understand that it's more complex than that. And doing Kegels, not that it's a bad thing, but it might not fix your issue if you have an issue.
So the point is, don't be self-diagnosing.
Yeah.
Don't be,
Yeah.
don't go to TikTok, Dr. TikTok.
Yeah.
Don't do your Kegels at the stoplights. I remember being told that every time
Yeah.
you go to the stoplight, do your Kegels.
Yeah.
Don't do any of that. Go
No.
see, get a consultation with a pelvic floor provider and figure out because what you're saying is patients can actually have urinary incontinence, leaking urine, even in the setting of tight pelvic floor. Is that correct? Okay.
Absolutely.
And that's pretty like counterintuitive. It doesn't.
Mhm. Absolutely. Yeah.
Now, what
Yeah.
about issues like prolapse? Is that the opposite of pelvic floor tension?
You could have pelvic floor tension and a prolapse. So prolapse happens when one of the organs is falling out of place. So pregnancy and delivery are risk factors for everything that can go wrong with the pelvic floor. So when one of the organs fall out of place, so I'm talking about bladder, uh, vagina and uterus and rectum. And so those structures sit inside of your pelvis and they're supported by walls which help to hold them in place. Pregnancy, delivery, those things might fall out of place. It's actually pretty common for things to fall out of place a little bit. So we call that a prolapse when things are not where they should be. When it becomes a problem is when it starts to create issues. So if it's falling out of place, it's you know we grade it, and so when it gets to like a grade 2, you may not know that you have it, but you might be having like incontinence or other issues. But it is true that you could have that and have tension in your pelvic floor. As a matter of fact, if you have tension in your pelvic floor and you have trouble urinating or having a bowel movement, you might be inclined to like bear down, like push, like strain on the toilet, right? Straining on the toilet is actually really bad for your pelvic floor because it can make a prolapse worse. And it's not relaxing, it's actually pushing and using more muscles versus relaxing. So again, like it's complex and it's important to like figure out what it is that's going on versus squeeze, squeeze, squeeze.
The more I listen to you talk, the more I think like maybe 100% of women need a pelvic floor PT consult. I mean,
Yeah.
what is the saturation of people in the wild? I mean, I essentially every single person that's ever birthed a human
Yeah.
probably has some level of pelvic floor dysfunction. Is that the case?
Yeah, yes. And I will tell you in other countries, it's much more common to go to a pelvic floor PT postpartum just as part of your routine care. So you go like, I just want to make sure everything's fine. And I love getting those patients, by the way. I love getting those European patients that are like, this is what we do. And we just go after we have a baby. This is normal. Versus in the US, it's like, I'm not going to go until I have a problem. And even then, like I probably have had it for a long time and I can't take it anymore, right? So it's already a chronic compounded condition versus like, let's just get things checked out, right? And that's a lot of like healthcare in the US in general, right? There's very little like preventative or like that. We wait until there's an issue and almost, I mean, I've had patients come in and say like, I don't know if I have a long hair. Like my symptoms are not that bad, right? Like, I don't know. I don't want to waste your time. And I like it's awful because it's like you believe that you're absolutely not wasting my time ever, right? Like you deserve healthcare and you have an issue that you know you deserve to get worked on, even if it's not like you know chronic pain every day. If you have an issue, you should get it fixed. You should get it
Well, not
checked.
only that, but I feel like that's so consistent with kind of Western women
Mhm.
that we even coming in to see me, they're like, oh my gosh, my frown lines have bothered me for so long. I hate them. Every time I look in the mirror, I'm
Mhm.
so like disappointed with how I look. I don't want to be in pictures. Like it affects their lives in huge ways. But the
Yeah.
amount of time it takes for them to come in and decide to do something about it because they have all these beliefs that they have to kind of dismantle
Right.
around, I can't spend time on myself. I can't spend money on myself. I'm just being selfish. This is normal. I should just live with it. There's a lot of shoulds, especially for women. Um,
Mhm.
and I think we're seeing it in all fields of life and medicine, which is we're supposed to be women right now are supposed to be full-time workers, full-time parents, take care of themselves, work out, make sure you're being a good, you know, make sure you're being a good role model for your children. It's like so much. When the hell am I supposed to get an appointment to see a pelvic floor PT in there?
Right. Yes, exactly. That's you like hit the nail on the head. And it's I think that, with age too, like my age, you get to a point where like I'm done. Like I need help. I'm going to get help. It's like you get to this point where you're like, no, I don't like this. I'm going to fix it. Right. I'm going to finally do something for myself. So you have to get over that, like feeling guilty about taking for yourself. Right. And I do believe that it gets easier with age. Like I know that like in my 40s, I'm like, I just have a very different attitude about, doing things for myself and doing things that I need and taking care of my health care or things that bother me. And I love that about this age is that, women are finally like, I'm ready to take care of this. I'm ready to do something for myself. I'm ready to put myself first.
I know, I
More
know.
of that needs to happen.
I just told my husband yesterday, I was like, so I never have painted nails. My nails are natural. I have nice nails, they're strong. But they're never painted because everything
Mhm.
just chips immediately. And I told my husband, I was like, I'm like, I really want to get my nails done. He was like,
Yeah.
okay, why are
Yeah.
you telling me this? I'm like, because I have to move heaven and earth to get my nails done. Like, when
Mhm.
am I going to do this?
Right.
It's ridiculous. And
Well, I think it's making that first appointment too, right? It's getting over that, like it's making that first appointment either with you or with me or making an appointment at the nail salon and getting it done and being like, I could do this. I have time.
yeah.
I can make time. I'm going to make time for this because this makes me feel good. It's important for my health and I'm going to do it, right?
And it with with pelvic floor stuff, even more than just getting your nails, sure, you feel great, but it could change your life. I mean, we're talking about urination, stooling, sexual dysfunction, even just walking around feeling comfortable. This whole idea that like I can't run or play with my kids how I want to because I might leak urine. I mean, those are going to affect people's lives
Yeah.
in really like chronic daily ways
Yeah.
that if they could heal that,
Hmm.
gosh, I feel like
Yeah.
they deserve it.
Yeah. Everybody deserves it.
They deserve it.
Absolutely. And you should never feel bad about, getting things for yourself, right? And doing things for yourself, doing what you need. And I think that's where the shift needs to go. We need to focus more on that, right?
Absolutely. With all this conversation on socials and the internet about like Kegels and lots of people are talking about menopause, if you had that sort of, loudspeaker, what do you wish that more women knew about pelvic floor PT or their pelvic floor health? What is your like, I'm gonna die on this hill?
Oh, so many things. I think, um, like, like don't accept that something is normal. That's what I think. I think don't accept that it's normal. I think like social media, like drowning out some of the like noise because I think there's a lot of pressure, right, coming from online about this is the way it should be. This is the way it should be. If I admit I have a problem, maybe there's something wrong with me, and I don't want to admit there's something wrong with me. So like getting over that and getting to a point where you feel comfortable talking about what you need and getting the care that you need. But yeah, I would definitely say like pain is not normal. That pain is an indication that there's tissue that isn't healthy. So don't accept pain as because pain is it's not the same as like no pain no gain, right? I hear that a lot too. Like no pain no gain. Okay, that's different. Like you get muscle soreness because you had a good workout, right? That's one thing. But like if you're having pain every time you have intercourse or every time you have your period or if those are not that's not a normal thing and don't let somebody tell you that, right? Don't let somebody tell you that you have to deal with it, right? Find another provider, get a second opinion, get help, right? Advocate for yourself. So important, especially in this healthcare system.
Yeah. Yeah. Let's throw out the normal word too. Like, just get rid of it. Like, patients use it and providers use it as a reason to brush things under the rug. Like, I
Yeah,
don't know if it's normal. Is it bothering you? Okay.
yeah,
Is there
yeah.
something we can do that's within your means and reasonable and reasonably safe?
Hmm.
Okay, let's
Yeah,
do it.
yeah, yeah, yeah. Absolutely.
Um, with all of the things that society is talking about, menopause, this, that, the other. And I feel like society is starting to talk a little bit more about women taking better care of themselves, although it's not being operationalized very well. Because they're like,
Right.
you should not stop doing anything that you're doing. Keep doing all the things, but you should take better care of yourself.
Yeah, yeah. I feel like self-care is a full-time job.
Yeah.
Drink more
Yeah. And it
water,
requires a
exercise
full-time salary.
regularly, relax, do this, do that, meditate, and spend all this time with your kids and your husband and do for everybody else. Like there's just not enough time in the day, right? So figuring out what works for you and being able to get, you know, time for yourself and do what you need for yourself.
Do you have any patient stories you can share with us about somebody in this age group that you've like helped a lot? Like what is that experience like for a patient? Let's say they come in and they're either having normal urinary incontinence or normal sexual
Normal.
dysfunction.
Hmm. Hmm.
And how have you been able to intervene to help people? Can you give us any example?
Yeah, so I mean, a big one is like with the incontinence and like overactive bladder. I'll give you that example because I've a whole lot of patients that have that. So it's like this is where like I'm urinating all the time. I always feel like my bladder isn't like I always feel it. It's uncomfortable. Like I feel like I need to pee all the time, and I have to go before I leave. I have to go when I get there. I have to look for bathrooms everywhere. I'm embarrassed because when I go out to dinner with my friends, like I have to go to the bathroom several times and they notice it's, that kind of thing that's happening where you can make huge differences. And a lot of that, what I just described was more like behavioral stuff that can, so it's not just like, we're going to fix all your muscles. There's a behavioral component that can improve the quality of life. So that's one I see a lot actually with the overactive bladder and frequency and like, it's so disruptive to your life because like I'm in the supermarket and I need to run to the bathroom, right? And I'm afraid I'm going to leak. Like I'm afraid I'm embarrassed and I don't want to go to my exercise class because I have to pee during the middle of it or I'll pee myself. So those are the cases where we can really make a huge difference and improve like okay, now I can make it through my exercise program. Now I'm not looking for it's that anxiety that comes with that too, because like now you're not looking for a bathroom everywhere you go. Um, I had a patient that you wonder how people fall into these patterns too, but like she's had pain with intercourse for 40 years. I mean, just like that's her normal. Like she's always had it. And as she was describing it to me, I'm like you had this for so long. Like this is not just like dyspareunia. This is actually another condition called vaginismus. Like you actually had so much pain, like you couldn't use a tampon when you were a teen, right? This is a whole other issue that she's like, well, got better after I just dealt with it. And then it got better after I had children. And, now I just pee myself and I deal with the pain. And it's just like, it's heartbreaking because it's like, that was your normal, right? And that's the thing, like if it's your normal, you just don't know, you don't know, and maybe you don't feel comfortable talking to people about it, or maybe you talk to somebody older who's like, oh yeah, that happens, or oh yeah, I've experienced that too, it's fine. No, it's not fine. So even if it's 40 years later coming to me and saying like, I don't want to live like this anymore. Yes. You shouldn't have had to live with pain for 40 years. You shouldn't have like, I mean, imagine like they've never enjoyed intercourse like because it's been painful every single time. Now imagine that and what people live with and what they live through. It's just yeah, and those are the cases where I can make a huge difference because it's like okay, you have spasms in your pelvic floor. Let's figure that out. Let's work that out. Just like if you had spasms here, right? It's a muscle. Let's work it out. Let's improve it. Let's stretch it out. Let's do all these things that can improve your quality of life. So yes, those
Yeah,
are.
so what does the treatment experience look like for a patient? Let's say I'm 41 and let's say I have some urinary incontinence. What do I expect coming to see you? Obviously, I'm going to have a consultation. What is the experience like for the next like few weeks or months for me
Yeah.
with
So the consultation gives me so much information because I'm trying to figure out, like, is it stress incontinence? Is it urgent incontinence? Is it frequency? Or is it both or all of those things, right? Do we have overactive bladder? Because then that gives me a sense of what's happening in your pelvic floor. Do you have weak muscles? Do you have tight muscles, or are they tight and weak, right? Is it a mixed bag? We got to work through all of it. So that gives me like a better understanding of like timeline and how it's going to work. So if you come in and we do an assessment and it turns out you have lots of tension in your pelvic floor, we focus on stretching and down, we call it down training. So down training is essentially the opposite of a Kegel. Okay. So you find your pelvic floor. I'm going to teach you how to find your pelvic floor, isolate it, and then we're going to work on relaxing those muscles. And for a lot of patients, it's really like recognizing when they're doing it. So I'll give you an example. So if you carry a lot of stress in your shoulders, which is most of us, right? Say you're doing this all day, right? You're just, oh, you're stressed out. You got to run your kids, all these things and everything. And then you're just like building all these like knots in your muscles. Well, so the awareness is like, what is your pelvic floor doing? Like your shoulders are doing this. Is your pelvic floor also doing this? So like recognizing that really helps with like making the change. So like I found my pelvic floor. I can squeeze it. I can relax it. I can do all the things. I have full muscle control, right? So once you get that, then you can make a change. And that depends on the patient because sometimes it's pretty easy for them to find. And then sometimes it takes a little bit longer. So we focus on really finding and then start doing what they need. So either Kegels, down training. If it's down training, if it's a mixed bag, we always down train before we strengthen. So if you had a tight muscle, we would stretch it. Like if your muscles were here, we would stretch your muscle out before we worked on any kind of strengthening. So that's usually what it looks like. I'm hands-on, so I do a lot of soft tissue work, so a lot of massage, mostly external, but some internal, depending on where it needs to be done. And sometimes there's an orthopedic component, so low back, SI joint pain, sometimes that needs to be corrected so that the pelvic floor functions a little bit better. And then we work on strengthening. So we do all of, and then sometimes there's some behavioral component too. So every time you come in, there's usually some massage, there's some exercise, maybe it's a prolapse and we just need to work on Kegels and core strengthening. So then that's the direction we go in. So you're coming in doing pelvic floor stuff, you're doing some strengthening, you're doing some stretching, there's some massage. And I also use like biofeedback. Have you heard of that?
I've heard of biofeedback, but not in
Yeah.
the
So biofeedback is really cool because biofeedback gives you a visual to something you can't see. I think the biggest problem with patients is that pelvic floor muscles are inside your body, so you can't see them, right? It's not like I'm doing like a biceps curl, right? Like this is all feeling. Like you're doing invisible exercises. So it can be very tricky to find your pelvic floor. So getting patients to that point where they like, okay, that's what it feels like when I do that. So biofeedback is a way to like, when you squeeze your pelvic floor or when you relax, there's a visual component. So you're seeing like things move on a screen and you're like, okay, when I relax, okay, that's me relaxing. Okay, that's me squeezing, that's me relaxing. So it builds that connection, between your brain and your body. So it really helps to improve like that control. And then we make progress from there.
video games with your vagina.
That's exactly what it is. There's like a pinball one where like when you squeeze, it does this like little, and it has like sound too. It's great. I love it. I love showing patients that one too because there's lots of giggles with it. But it's great. Yeah.
Do you ever get, I imagine there are some patients that are scared of the internal component of the work. How do you
Yes.
help people work through,
Yeah.
especially people with pain
Right.
or a history of sexual assault? I mean,
Yeah.
how do you help people work through that so you can help them feel better?
That's usually something we establish in the evaluation or the consult. So like if there is trauma, usually, if a patient feels comfortable telling me that in the beginning, then that's something like I'll know moving forward. It's always to a patient's comfort. So if a patient doesn't feel comfortable doing an internal exam the first visit, then we will hold off until the patient is ready. Or there's usually lots of things we can do until we can get to that point, right? But that internal component does help a lot. So if somebody is not comfortable, we will not do it. We'll do as much as we can. And then when they feel comfortable, we will try to do it. For some patients with a lot of pelvic floor pain, we can't. And it takes time. Like we do stretches, we do massage, we do all these things to help get to that point. There are sessions where sometimes my treatment is just putting pressure on the perineum just to get, desensitize it, and sometimes that's the first step that some patients are at that point and that's what they need. So sometimes there's dilators that they use at home for homework, but it's always with the patient comfort. And our exam, it's kind of like going to the gynecologist. We don't use a speculum, so it's not like, there's nothing being inserted in there. It's usually one glove finger, so it's usually pretty tolerable for most patients. Yeah, but it does help us get a sense of what's happening. Because I've had patients like, oh, no, I don't have any pain. No, there's no pain in there. And I'm just palpating pelvic floor muscles and, that hurts. Oh. So yeah, like there's stuff in there that maybe you didn't even know was there. And so we palpated it. So the part is really important, but it's all to a patient comfort, and every visit, if we're planning to do internal work, it's like, are you comfortable doing it today? Great. If you're not, we hold off. Some patients are really uncomfortable having internal treatments on their periods. There's lots of things we can do. So it's all about patient comfort, because if you're uncomfortable the whole time, right, and we don't want this, we don't want you to yeah. So that's a super important component to our treatments.
It must be a real gift of yours putting people at ease because yeah, if you can't put them at ease, like your treatment's not going to be effective.
Right. It's true. It's definitely true. And I think like just having a lot of experience has really helped with that, right? And having been there and like experiencing those things myself too, like I know I get it. I get it. And so I think that's really important in listening to patients and understanding where they're coming from. And we can usually figure it out. So.
Now, going back to the patient experience, how long does it typically take for people to see any sort of improvement? Like, are we talking,
Mhm.
I need 8 visits, 6 months? Like,
Mhm.
what am I looking at for a timeline?
Yeah, that's a great question. I mean, it depends on what they're coming in for. There are some conditions where like, I already know, like it takes time, like especially if it's, you know, pain with intercourse, but severe pain with intercourse, because then that gives us a sense of like where we start, because sometimes we start with just pressure there, and so when we're starting there, it can take a lot longer. It can take months. But typically what I tell patients is it takes about 6 to 8 weeks to see a change in muscle strength and length. So that gives us a good like beginning time frame of, you know, how long it's going to take. And I typically see my patients once a week. So they're coming in once a week. We're doing all these things. I have expectations about what they're going to do at home. And then we make progress from there. But every visit we're checking in, like, how are you doing? Better, worse, same. I just like come in and I'm like, better, worse, same. Like what's happening? Then we go from there. Like then we like if patients are making great progress and things are improved, great. So I'll see you in a couple weeks and then we'll plan your discharge. So that's, it depends on the patient, but yes, about 6 to 8 weeks. Sorry, that was the long answer to your question.
No, I mean, obviously everybody's different. I kind of know that, but I like myself, if I'm thinking about, okay, I'm going to start this journey, it's a hump for me to get over to
Mhm.
like even make the appointment, right? I'm going to spend the money, I'm going to spend the time. Like, what am I getting myself into? I feel like I will be more likely to follow through if I know what to expect.
Yeah, yeah, yeah.
You also help younger women as well, right? Especially because there are much younger women that have issues with intercourse. They get what other pelvic floor disorders? Like I'm thinking of, women in their 40s to 60s often have daughters in their 20s and 30s or even
Mhm,
teens. What
mhm.
are some of the dysfunction that younger women, or what are the main issues that younger women would face?
I do have a good deal of patients that have endometriosis. So that's a really painful pelvic floor condition where they can present with pelvic pain, back pain, pain with intercourse, pain with periods, muscle spasms in their pelvic floor, all kinds of things that's a really common one for my young women, and that's usually.
I would have had no idea that PT could help with that.
Yeah, that's a
Wow.
really I really enjoy working with that patient population because there is a lot of relief that you can give. It's a chronic condition. So sometimes, patients are waiting to have an excision surgery. So they'll go in and they'll remove some of that endo tissue, and that can provide a lot of relief. Or sometimes I'm seeing patients after they've had that surgery trying to work toward, improving pain with intercourse, or whatever it is that they're at that point for. I do see, in that age range, or like later 20s, patients having issues with fertility. So fertility is a big one, especially with endometriosis. It can cause issues with fertility. So I've had, a good deal of patients starting IVF, or have been through a few cycles of IVF, and they've just got so much pain and tension. It's a very stressful, uncomfortable process, and so it creates a lot of tension. And so for those patients, we're really working on relieving some of that tension in their pelvis and their pelvic floor to help improve like outcomes with IVF. So I love working with that patient population as well.
Gosh, two
Um,
things I would have, like, if somebody said, oh, I have endometriosis, or oh, I have infertility, I wouldn't have been like pelvic floor PT, but that's fascinating that you can help with
yeah.
that.
Yeah, I think it was like the findings were kind of coincidental. Like as patients were getting treated for pelvic floor issues, their fertility improved, and it wasn't something that they were trying to do, but they found, like, as a result of this, like, we're freeing up muscle tension, right? So it's like a mechanical obstruction. So freeing up these muscles that are preventing sperm meeting egg, like that has allowed me to become pregnant. So it's kind of those mechanical stuff that they found really works. And so I love that, because it's just, it's so stressful, it's so time consuming, it's so expensive, and like just getting some treatments and helping figuring out what you have. And if it can improve your chances, I mean, it's just great. Yeah.
That's amazing. How
I,
gratifying too.
it's great. Yeah, absolutely. I do have a good deal of younger patients that have incontinence, they've got, and they haven't had children. They have a really tight pelvic floor, or they've got some dysfunction that is causing it. So yeah, yeah.
Fascinating. Well, thank you so much for chatting with me today. I think this is, I just like connecting women with other women, quite frankly, who can maybe help them in really unique ways. And this whole conversation has been fascinating. Like, I learn things every time I talk with you about how basically our lives could maybe be better if we knew that we had the resources, people like yourself. So thank you so much for chatting.
Well, thank you for having
You
me.
are located in Bedford. You do in-person treatments in Bedford, right?
Yep.
And where can people find you, like online or on socials?
On Instagram and Facebook, it's at Wellbridge PT. And online, it's wellbridgephysicaltherapy.com. And
Awesome. And
yeah, Bedford.
you are accepting new patients, correct?
Yes.
Okay. All right. I was like, oh gosh, I hope she's not like closed.
We're definitely accepting new patients. We have a few really great providers in our clinic, so we are accepting new patients. Yeah.
Awesome.
And one of the other PTs we have in our practice treats kiddos too.
Oh, really?
Yeah.
And Wellbridge PT as a group does all sorts of PT, not just pelvic floor.
We do ortho. Yeah. I do. Yeah. I'm ortho with pelvic health specialty. I know I always have like the pelvic floor patients are like, but you're not like a regular PT. And I'm like, I'm a regular PT. I do regular PT, but I also do pelvic health. So yes, we do ortho as well.
Well, thanks so much. It was great
Thank
chatting with you.
you.